Good morning, everyone. Thank you so much for joining us. My name is Rita Kutsevimos, and I am the Executive Director of the BC Alliance for Healthy Living. And we'll just start by acknowledging that this webinar is being broadcast from the unceded traditional territories of the Squamish, Musqueam, and Tsleil-Waututh. I'm also joining you from adjacent to the Seychelles territories, and it's our privilege to live in these lands. Our presenters would also like to acknowledge with gratitude and respect that they live, work, and play on the unceded traditional territories of the Squamish, Musqueam, and Tsleil-Waututh First Nations, the Lekwungen speaking people, the Wasanich, the Esquimalt, Songhees, and Algonquin people. And we like to provide that acknowledgement by recognizing that we are living on stolen land that was taken by colonial force, and just to acknowledge that those forces still contribute to the institutionalized racism to this day. But as an organization, we are committed to health equity and justice for our Indigenous friends and neighbors and nations. So the purpose of our webinar today is to share with you some interesting findings from 5 years of research in BC early years education and childcare settings. Over the last few years, this research has explored the capacity building and policies, practices, and environments that support physical activity and physical literacy in the early years. A core pillar of BCAHL's work is physical activity, given its central role in chronic disease prevention over the lifespan. Starting early by developing physical literacy in the youngest British Columbians provides a really nice foundation for a healthy, active life. So we hope that you'll enjoy our program today. But before we get started, I just wanted to go over a few housekeeping items. So first of all, sound check. If you're having trouble hearing us, just try turning up the volume on your phone or computer. We really want to get your input today. So we'll be asking you to use the control panel on the right. It should be on the right-hand corner of your screen. And just type in the questions in the Q&A section. And we'll be having a round of questions after each speaker. And then we'll do a final round of Q&A at the end of all of the presentations. So, and in that Q&A, we're going to try and get to as many questions as we have time for. But if we do miss any of the questions, then we'll send out a post-event email with those missed answers. And just so you know that this webinar is being recorded, and we'll post a synopsis along with the presentations on the BC Alliance for Healthy Living website. So we will be having 3 presentations today that together will provide you with a full overview of the research. To start us off, it's my pleasure to introduce the speakers, beginning with PJ Naylor. And Dr. PJ Naylor is an emeritus professor in the School of Exercise Science, Physical and Health Education at the University of Victoria. Dr. Naylor's research incorporates socio-ecological and settings-based approaches to children's physical activity and physical literacy, focusing on the environments where children live, learn, and play. She is also passionate about the implementation and scale-up science. In other words, how we facilitate the widespread use of effective strategies. Dr. Naylor is a key partner in the evaluation of the Director of Licensing Standard of Practice for Active Play and the Appetite to Play Capacity Building Initiative. Our second speaker is Dr. Claire Tugault-Lafleur, and Claire is an assistant professor in the School of Nutrition Sciences, Faculty of Health Sciences at the University of Ottawa. Prior to her appointment at the University of Ottawa, she worked with Louise Mâsse and Dr. PJ Naylor on A Good Start Matters. Dr. Tugault-Lafleur's research program emphasizes healthy eating in children and youth and is shaped by her background as a registered dietitian, fusing methods and theory from nutrition education, public health, behavioral, and implementation sciences. She also has a strong interest in designing and evaluating multi-level interventions to promote optimal health outcomes for Canadian children. And we will wrap up with our third and final speaker, Professor Louise Mâsse. Dr. Mâsse is a full professor in the School of Population and Public Health at the University of British Columbia and a level 3 scientist at the BC Children's Hospital Research Institute in Vancouver. She leads an active research program in childhood obesity treatment and prevention and focuses on evaluating policies and capacity building interventions to influence children's physical activity and dietary behaviors. She co-leads with Dr. Naylor the evaluation of the Active Play Standard and Appetite to Play Capacity Building Initiative in BC, aiming to gain a deeper understanding of ways to increase opportunities for physical activity and healthy eating in childcare settings. So we certainly have some wonderful expertise in the room, and I am so looking forward to our presentations. So we'll start by turning it over to you, PJ.
Okay, thank you for those lovely introductions, Rita, and good morning, everyone, and thanks for joining us. As Rita said, the main focus of the webinar is giving children in the early years a good start. Specifically, Louise, Claire, and I are going to talk to you about the last 5 years of research in BC about changing components of physical literacy and physical activity in childcare settings. I'm going to have the privilege of setting the stage, talking briefly about why stakeholders took action in BC and likely why you're here as well, what it looked like, and then what we found out from the Appetite to Play research evaluation. While Claire and Louise will focus on the data from the Good Start Matters trial. Before I begin with the overview, I need to acknowledge, and you see this very busy slide, that this work couldn't have happened without the many partnerships and funding that are on the screen. The baseline survey was funded by the BC Alliance for Healthy Living with funding from the BC Ministry of Health Physical Activity Strategy Action Plan. We then received money from the Social Science and Humanities Research Council, SSHRC, and the Sport Canada Sport Participation Research Initiative to conduct a follow-up survey and qualitative interviews to assess the impact of what went on in BC on childcare policies and practices and factors that contributed to that. And then finally, the Canadian Institutes of Health Research, CIHR, funded the trial to measure the impact of all this on children and to reassess what's going on broadly across the province. So you can also see that we have research partners in many institutions, including one in Australia. And last but not least, I want to highlight the capacity building initiative partners, those involved in scaling up Appetite to Play. And this doesn't represent the number of British Columbia stakeholders that participated in the development of it. So many partners and a long time collaborating to create change in BC. So, okay, without further ado, let's talk about why the stakeholders in BC wanted to take action and what that action looked like. So many of you will be, because you're here, will be believing in this. The evidence is showing that physically active play is essential to healthy child development. And it's not just physical development, it's social, emotional, and cognitive health. There's a lot of evidence that it contributes to a broad range of developmental factors. And the second area of evidence is that this particular time of life provides a window of opportunity where children are very confident to try. They're not comparing themselves to others yet, and they're developmentally primed to build motor skills. Not only that, but there is evidence for action as well. And action is based on the evidence from childcare or other settings like schools or issues like tobacco and road safety that higher level policies affect implementation or action in the program level. And there's also evidence showing that capacity building enhances the implementation not only of policy, but of practices. And finally, there's very specific evidence in childcare showing that policies and capacity building change policies and practices of childcare facilities. So not only did we have a reason to act, we also have evidence that acting will create change. Now, what happened in BC specifically? First of all, the government in BC released the Director of Licensing Standard of Practice for active play. It is a legal requirement for licensed childcare facilities in British Columbia. It includes they must offer greater than 60 minutes a day of outdoor active play, facilitated and unfacilitated play, opportunities for fundamental movement skill activities, limiting screen time and breaking up prolonged sitting, having written policies around active play and screen time, and providers modeling active play opportunities. It also recommends 120 minutes per day of physically active play. Many of you will be familiar with it. What's interesting was it was released in June 2016, but had a year of education before enforcement and began in September 2017. And this coincided with the second major initiative in BC called Appetite to Play and followed our baseline survey. So Appetite to Play launched also in the summer of 2017, and it was developed through extensive consultation that I talked about with stakeholders from the early years, education, public health, and physical activity sectors. And it was meant to be a one-stop shop to build the capacity of early years providers by providing online resources, ideas, and games, tools like physical activity planners, and audit to see what the childcare was doing, training online, in person, virtual, and asynchronous, and then it was all based on the latest evidence. So we have the policy and we have the initiative. So this gives us our research context and purpose. So we have the Appetite to Play online resources, and we have in-person workshops for over 2,700 early years providers combined with the active play standard. And our research purpose was to explore the implementation impact of the standard and capacity building on implementation outcomes, ECC policy and practice outcomes, and the impact on children. Next slide. So today I'm just overviewing the results, and some of you may have seen these presented in British Columbia before, the ATP Appetite to Play implementation, which was largely based on REAIM. And we measured reach using workshop tracking and web page analytics. We measured effectiveness from pre and post workshop surveys, changes in knowledge, confidence and intention, and satisfaction. Then we looked at implementation, mostly barriers and facilitators, through qualitative interviews with workshop participants and delivery agents, and tested the different models quantitatively for virtual, in-person, and the online e-learning. And then we assessed the context for action through our qualitative interviews. I'm going to give you a snapshot of the data today, but if you're interested in following through, you can check out the publication by Kazra Hassani and all of us there. Next. So what was our reach like? We had a lot of regional trainers, 88, that were trained through 7 regional training workshops, and they were all across the province. And these regional facilitators, next slide please, delivered 195 in-person workshops in 97 communities, reaching 2,328 participants over an 8-month span. So there was good reach. You can see it here on the map. Next. And then we also delivered, we also delivered 10 virtual workshops, 164 participants from 42 municipalities, plus another 270 care providers took the e-learning physical literacy course. So overall, we reached almost, 2,762 early years providers trained in 18 months across the 3 choices and modalities. Okay. The web resource also had broad reach. We had 25,278 visits over 18 months. Most people spent about 4 minutes there and did about 4 to 4.5 actions per visit. And about 40% returned, close to 10,000 people returned and spent even longer there with 5 actions per visit. So that was good reach. Now, who did we reach? Largely it was between 20 and 50-year-olds that were 0 to 10 years of experience in the early years setting. 60% of them reported being ECEs. And you can see that we had a broad range of programs that were affected, but mostly preschool and group childcare. Next. And workshop satisfaction was high across all 3 types of training. You can see it here, in-person, virtual, and the e-learning. They were satisfied with the content, the delivery, and they said the training would be useful. And 100% of the measures, when we're looking at efficacy, 100% of the measures of knowledge were significantly improved in the in-person workshops. This is a sampling of them where we asked about knowledge of physical literacy. It increased of manipulative skills, locomotor, facilitating PA, adapting, things like that. This was also mirrored in the next slide about confidence. 100% of the measures of confidence were significantly improved from pre to post workshop. And again, here's just a sample of some of the things we measured. The only thing that differed was on the e-learning course, it had some content that wasn't covered because it was shorter. And so some of the areas in the e-learning workshop didn't show differences. But across the virtual and the in-person, exactly the same. Thanks, Brendan. Next slide. So after the workshop, what was really good news is post-workshop intention to implement was high, and their self-reporting of what they felt whether they would enjoy implementing. So this was high. So it was universally high across the workshop types. So what does this show us? In summary, we had appetite to play capacity building in the context of a new active play standard, and it created providers changed their knowledge, confidence, and intention. This is theoretically and based on previous evidence around the world associated with changes in policies and practices of the childcare facilities. And Claire and Louise are going to talk more specifically to this connection. Thanks, and I'm open to any quick questions before we pass on.
Oh, that's great, PJ. Thanks so much for that. That's a nice overview. And I just would invite everyone to put your questions into the chat box there or into the Q&A box. Let's start off with this question. What did you find that early childhood educators liked the best about appetite to play?
Oh, well, what's interesting is, depending on which workshop it was, many people really appreciated the face-to-face and the hands-on activities. It was quite experiential, so they got to play those activities, they saw their use. And then on the other side of the coin, the breadth of opportunities that were offered when it reduced some of the barriers. So people found it was flexible, they could do it in their own home, and there was less hassles about traveling. So they enjoyed the interactive. It was very hands-on, and some the face-to-face, but conversely, the people that did it online felt the flexibility and the ability to do it in their own home was an advantage. So both of those two things, the at their fingertips and the experiential learning.
Oh, well, we're living that hybrid reality now. I think that's the next phase. So you guys spearheaded that. Yeah. I have a question here. In the training, were there any Strong Start Center staff trained?
Yes, there were. It was disseminated through all the Strong Starts, and we did see Strong Start staff participating.
Great. Another question here. PJ mentioned that children at this stage are open to exploring and gaining motor skills without comparison to others. When does that start to change?
Well, this is another research arm that we're doing at the University of Victoria with my colleague Vivian Temple. And they start to see the association between perceived ability strengthening up as they enter the early years and then into grade, depends on the child, but when we're starting to get into grade 2 and 3 and 4, they start to get more capable of assessing where they stand in comparison. When in the early years, they're saying, okay, look at me jump, and they're not evaluating, are they really jumping high? They're just saying, look at me jump, I'm doing it. They're very positive. As they grow older, they become a little more aware of whether they're performing the task appropriately, and then they do that a little bit more comparison. So into the early primary years, it's starting to develop. And very much in the older elementary years, they will be able to assess accurately where
Yes.
they're.
Yeah. So good to get them before they start judging.
Yeah. Well, at least before they get accurate.
Yeah. That's great. And one other question here before we move on. So knowing that indoor and outdoor space are so important for active play, what can be done in early childhood education settings that are really limited in space?
Yes, so some of the things that can, number one of the things with Appetite to Play and the activities on the website is they really focus on things that can be done indoors and with equipment that doesn't cause damage or hurt children. So a lot of scarves, light balloons or balls, bean bags. So some of it is choosing equipment that it can be done anywhere in limited space. But the other thing is that a lot of childcare where they do have limited space, they are traveling using active transportation, which counts as physical activity time, to go to parks and other outdoor spaces that are accessible in the community. The other thing you can do is modifying space. So having routines of storage where things could quickly move to the side and back again. Indoors and outdoors, there is some ability to modify in limited space by moving equipment and having more mobile equipment versus fixed equipment. But a large amount of the people with small space are traveling to play spaces to get their outdoor time and physical activity time.
Oh, that's great in terms of having little community adventures as well, isn't it?
Yeah.
That's excellent. Well, thanks so much, PJ. I think we'll just pause it there, and we will ask our audience to please send in more questions for PJ and for Louise and Claire. And then we'll have a big Q&A at the end. So now it's my pleasure to introduce Claire Tugault-Lafleur, and I'll just turn it over to you.
Thanks, Rita, and thanks, PJ, for really setting the stage. I'm excited to present these results because I guess I get to be the bearer of good news. I think it's really a good news story that I'm going to talk about today. So, as PJ mentioned, with this project, we wanted to describe the level of implementation of the active play standards in British Columbia. And specifically, our question was that we wanted to determine whether the childcare environment changed with regards to center level physical activity policies and practices following the enforcement of the active play standards and the capacity building intervention Appetite to Play. So next slide, please. So this slide gives you an idea of the timeline of our provincial surveys in relation to the timing of the intervention of the active play standards. So what we did is we distributed surveys to licensed childcare facilities that serve children aged 2 to 5 years. And we sent the surveys just before and about a year after the enforcements of the active play standards. We sent emails to managers using publicly available center information. We sent invitations to childcare resources and referral agencies. And because we wanted to reach both managers and staff working within these facilities, we asked managers to forward the survey to their full-time staff. Centers were eligible to participate if they were a group-based childcare center or a full-day preschool, and if they cared for children aged 2.5 to 5 years of age. So next slide, please. So in addition to demographic characteristics about the respondents in the center, we asked respondents about the presence of center level policies and practices. And we looked at 9 different types of policies and 6 different types of physical activity and sedentary practices. So moving on to the next slide, this slide shows you an example of the type of questions we asked about policies. So for instance, we asked, does your facility include a statement about staff provision of activities that address fundamental movement skills, with response options being no, yes, but an unwritten policy, or yes, a written policy. And for the purpose of coding, we grouped where we categorized centers as either having no written policy if they answered no or yes but unwritten, or yes, they had a written policy. So next slide, we also asked about center level practices, and you can see the 6 different practices that we looked at. So some of which really aligned with the active play standards. So we asked about practices regarding fundamental movement skills, whether children were engaging in a minimum of 120 minutes of active play per day, whether there was an effort to limit screen time, whether there was any staff role modeling, both of screen time and active play, if they avoided prolonged sitting, and if they emphasized outdoor 60 minutes of outdoor active play per day. So moving on to our results. First, who did we reach with these surveys? Well, we were able to reach close to 1,500 participants or respondents both survey years, and those participants came from 970 centers from across British Columbia, and you have the more specific numbers both at time 1 and at time 2. And now we reached a little bit fewer respondents at time 2 compared to time 1. But in both of those survey years, we had about 60% of respondents being managers and about 40% staff. Those were centers which cared or had on average between 37 and 38 children enrolled in their different programs. So next slide, yeah, perfect. So in terms of the implementation, we had a question at time 2 asking about whether they had a licensing officer coming to review whether the facility, whether the facility met the active play standards. So it was a very high level of implementation. We had 98%, so almost everybody who responded to the survey said that a licensing officer had come to their facility. And of these respondents, 89% said and confirmed that the licensing officer had reviewed whether the facility met the new active play standards. However, when we asked about appetite to play training, we found that only 22% of the respondents had completed the appetite to play training, whether online or in person, but the majority of them had completed the in-person training. Next slide, please. So this slide gives you the proportion of centers with written policies at baseline in that light colored blue. So before the enforcement of the active play standards. And if we move on to the next slide, you'll see a big difference between time 1 and time 2. So you see the prevalence of centers with written policy at time 2 in dark blue. And those differences are not only statistically significant, they're pretty meaningful, especially for those particular policies that really were aligned with the new active play standards. So what we see, for instance, is that, next slide, we see that those specific policies around fundamental movement skills or total amount of active play, outdoor play, and screen time, which were really aligned with the standards, the active play standards, that's where we saw the biggest increase in comparison, for instance, with whether the center had a written policy for physical activity training for their staff. Now moving on to the practices, you can see on this slide here where those are staff or manager reported practices. We see the baseline results. So before the enforcement of the standards, most of the respondents said that they were implementing already those practices, either most days or daily. So it was already high at baseline. And then in dark blue, next slide, we see a bit of a change, but overall we see that there's not a whole lot of variation. So there's what we call sometimes the ceiling effect, where people were already responding, that they were implementing those practices at baseline. So we did see some statistically significant difference, but not to the same extent as what we saw for center level policies. So what does this all mean? To conclude, we found that both the enforcement of an active play standard at the provincial level, combined with capacity building initiative, Appetite to Play, really resulted in an increase in center level policies over a two-year period. But at the same time, we didn't see large changes in physical activity and sedentary time practices reported by childcare providers. Like I said earlier, this could be due to ceiling effects in our measurement scales. It could also be due to social desirability bias. But more importantly, I think these results also highlight the importance of looking at more objective child level measures of physical activities. So if you're curious to hear more about those results, or if you're in the sort of healthy eating and nutrition world, we've published these results. Those are open access. And within this paper, we also look at differences in center level policies related to healthy eating, which I didn't talk about today. Again, I just want to say thanks for a wonderful postdoc opportunities with Louise and also PJ. And I put my email here if you have questions or comments or need to reach me. Thank you.
That's great. Thank you so much, Claire. Wonderful evaluation and some really interesting data there to really think about. I'm just going to encourage everyone to chat, put your questions in the Q&A box on the panel on your left-hand side. We do have a question for Claire. Are there resources on Appetite to Play that could help in writing a policy statement for active play?
So my understanding is that there are some resources on the Appetite to Play website. I think PJ would probably be the best to sort of comment additionally on that, but my understanding is there are definitely some resources, and that was definitely part of the also Appetite to Play training. Was there was a component about developing a center level policy that would also sort of take into account the context of a particular center. So yes, definitely.
Yeah, and I'll just add to that because I'm familiar with the Appetite to Play resources, and there is just an incredible amount of support there for people in early childhood centers, and anyone who's on the call today who is coming dialing in from a center. We just encourage you to visit that site. It's a wonderful resource, and they are there. There is fresh material on there, and it's really just really great, useful, practical material. I have another question here. Did you assess the role of the licensing officer in the study, i.e. whether they felt capable of promoting the policy and supporting implementation?
That's an excellent question, but our surveys weren't sort of geared at licensing officers, so that would be an interesting question, research question to look at that. I'm not aware of us assessing that in that particular project, but yes, definitely something to consider. And
I have a related question. So was there any cross-referencing in the data? So what about the 10% that didn't get the visit from licensing officers, and how much play was provided in those centers?
So just to clarify, of the respondents or the survey respondents, we had 98%, so 98% of them saying that they had a visit from a licensing officer. So in terms of making sure that licensing officers visited the site, I think what our results suggested that there was definitely a visit, and there was definitely an assessment from the point of view of having a person visit. Now, what's interesting is 89%, so about 10%. Yeah, I'm not sure why, what other things maybe that the licensing officer looked at, but they didn't didn't remember that the licensing officer perhaps asked about, does your facility meet the active play standards? I suspect there could be also measurement error happening there. It's possible also that the person who responded to the survey maybe wasn't aware. So some centers also have more than one manager. So again, I'm not too sure about the sort of specifics, and I wouldn't put too much weight on the specific numbers, but what I think we can be confident is that there was definitely some level of enforcement happening, definitely with the provincial standards, judging by anyways the high number of people saying that their licensing officers had visited centers.
Great. And then I have another question here. Why do you think policies change but not practices so much?
That's a good question. There's probably more than one reason, but we know from past research in Canada that, when we look at the baseline prevalence of centers with written policies, what we saw in early 2017, 2018, the proportion was similar to what we've seen in other places like Ontario. So not every center has a written policy on physical activity. We've moved a lot because of my postdoc life, and my children went to different childcare centers, and I've seen a lot of variety when it comes to written policies on physical activities in the different centers that my kids went to. So there's definitely a lot of variation. And so maybe there was more room for changing in that regard, and sort of having written physical activity or sedentary policies in the parent handbook at the center level. So there was maybe more room for change versus, practices, maybe not so much. But I suspect also it's, there's a big limitation when it comes to assessing physical activity by self-report. There's inherent social desirability bias, the same way there is in nutrition. People know, they should be eating well or being more active. And so that can definitely skew things. And so I think it's important eventually to look at child level measures and more objective measures of physical activity and diet too.
That's great. Excellent. I have another question here. Do you feel you are reaching or impacting the multicultural community programs?
That's a very good question. We didn't have specific sort of questions in the survey regarding, for instance, if they were serving particular population group. But what I will say is that these surveys were really distributed at the provincial level, and there was a very good good reach in terms of postal codes, because I had to look at different postal codes and looking at whether we were reaching socio-demographically sort of diverse places. From what I've seen, these surveys reached lots of respondents from lots of different contexts, both urban and rural, and probably very diverse communities as well. So that was sort of, I guess, the strength of using an online surveys. We were able to reach a lot of childcare centers. The downside, a lot of that data was self-reported, so maybe not so objective. So pros and cons to research designs.
Well, looks pretty good from where I'm sitting. So thank you so much, Claire. And I think we're going to move on to Louise now. So thanks for that. So now I'm going to turn it over to you, Louise.
Okay. Well, thank you. And I'm going to talk about how we support implementation and then the lessons we've learned from the Good Start Matters study. Next slide. So PJ set the context for us. So what I want to talk about is what are the factors that predict change in policy and practices related to the active play, and specifically focusing on the BC context where we had a policy enacted for active play and where we had a capacity building initiative to support its implementation. Next slide. So this is a recap of what we've learned from Claire in terms of the data we collected as part of our study. So I'm going to go very quickly, but then as we remember from Claire's, the active play standards were released in 2016 of July. And then in 2017, they became enforced. And at the same time that they became enforced, the Appetite to Play initiative was sort of released to sort of support the implementation of the Active Play standard. And the data that I'm going to be talking about was collected, like I show you in a schedule here when they were collected. So I'm going to present the data that we collected quantitatively. So it's the same survey that Claire talked about. And essentially the first survey was before the Active Play standard were enforced. And the second survey was about 2 years after the Active Play standard were enforced, and we had the Active Play initiative that became available as well. We have a total of 146 childcare facilities that responded to the survey, both at time 1 and time 2. And this is the one I'm going to be looking at in terms of change in policy and practices, because we have that information from those 146 childcare facilities. We also collected data qualitatively from 23 people who attended the in-person ATP workshop, and then we asked them, what actually supported their change in practices. So these are the data that we'll be looking at in terms of factors associated with change in policy and practices. Next slide. Our question, both for the quantitative and quantitative survey and qualitative interview, were informed by socio-ecological theory and implementation sciences. And this figure is quite busy, but I'm going to focus on a few key things here. Is that the constructive factors you see on this slide are all the factors we were looking to see whether it influences our change in policy and practices. And essentially, the first block that you see at the top of the slide are the characteristics of the childcare setting. So we know that the childcare setting can actually influence change in policy and practices. So we're talking here in terms of just an example, like organizational climate, culture, and capacity. And then the next layer is actually characteristics of providers, like the staff themselves. Do they feel like they have the skills, the self-efficacy? Are they committed to changing and trying and then sort of implementing the Active Play standards? So that's another layer. And the last layer is that we often think about the attribute of the standards, like what we're promoting people to change, and the intervention in the Active Play standards, like, is it feasible? Is it something that people think they could actually implement? So those are also the components we looked at in terms of what influence change in policy and practices. Next slide. So this is a busy slide, but I'm going to focus on the 4 policies, change in policy from our quantitative findings, and each columns represent one of the policies. So the first one is we looked whether the childcare facility changed policy related to fundamental movement skills. The next one we looked at is screen time policy, active play, and outdoor time, and look what factors actually supported the change. So the first layer is in orange, characteristics of childcare facilities, is you see that we have a number of aspects that sort of supported change in policy. So then if the facility had the capacity, space and equipment, staff commitment, and then institutionalize some of these changes. In terms of the layer of characteristics of provider, we saw that self-efficacy of the childcare providers sort of supported more change in the policy with related to outdoor time. And we also saw that flexibility and triability of the Active Play standard in the Appetite to Play initiative sort of supported change in fundamental movement skills. Next slide. So this is a similar slide and similar layout in terms of looking like what predicted change in practices for the same policies that we've been talking about, but now we're talking about, does that support change or increase in practices related to fundamental movement skill, screen time, active play, and outdoor time? So we saw again, commitment and capacity, space and equipment sort of supported change in practice. But we also saw that attending the ATP training was key specifically for supporting change in fundamental movement skills. And this is actually quite key because the active play training program or initiative was really trying to actually support and then help people implement fundamental skill activities. And we also saw self-efficacy to be important. Next slide. Now, one of the things that we did see is that facility will improve their practices where those who had less capacity. And then we had a question about this, like, is that possible for people to change their practices if their capacity, space, and equipment is not as plentiful? And then we did see that we saw more changes among those facilities over time, because those were the ones who were less compliant to start with. And then we suspect that they became much more aware that they needed to make change, and they actually did make change over time. So that was actually quite a great findings, and then probably supported by the active play standards. That's one thing that we observed. Next slide. Now, the qualitative finding provides us a bit more detail as to what we found, and something that maybe if you are in a childcare setting can sort of reflect us, what is it that you can do or can support changes in practices. So one of the things that we saw is that those who attended the training, they found that it increased their awareness and knowledge of the active play standard, their expectation of what they needed to implement, and then made them really aware what are the resources that they could actually use, and then could actually become more competent in changing their practices. And attending the training actually prompted the intention and commitment to change their practice, and actually realized that, you know, they realized that what we were promoting, the active play standard, was really compatible with their belief in personal value. And they also saw that the active play resources and tools were quite simple to use. Next slide. And another thing that we didn't find, and it's actually kind of important to reflect in terms of when you want to support people to change their practices, is that people who had higher level of physical activity found that it was much easier to actually implement the active play standard. And if they actually have more experiences, like if they spend more time in a childcare setting or were a parent, they felt more competent to actually make these changes. And then having the skills to meet the various needs of the children was also kind of important for them to actually feel competent into implementing the change. And actually and we also heard from some of the participants that if they had someone who could teach them how to implement, you know, fundamental muscular activity was quite important. So having a champion that could support like new staff could be very important. Next slide. And for managers, it's actually important to think about what infrastructures you provide in terms of space and equipment, because I found it was kind of actually helpful if you had this. Another thing that was also mentioned is having a schedule that is set by the childcare facility could actually support the implementation. So if you actually have time into the schedule to actually incorporate active play activity, or if there's enough time to actually for outdoor time in the schedule to actually meet the standards. Having organizational support such as culture, climate, and training was key, as well as having policy and practices was also key. Next slide. This actually synthesizes all the finding that we found from both the qualitative and quantitative finding. So what we did find is that there's a number of factors that predict policy change, including having capacity, commitment, institutional policy, as well as having the staff that has the skills for physical activity, and perceiving the active play standards to be quite flexible. And these were actually very important in predicting changes in policy. And theoretically, we know that they also support changes in practices. Next slide. We also found that the appetite to play training was actually very instrumental in predicting change in practices, specifically for increasing fundamental movement skill activities to be provided. Next slide. We also found that there's a number of aspects that supported practices and changes that we heard from the people who were attending the training. Is that, first of all, having simple resources and tools instrumental to sort of support change in practices, having experience and capability, having positive organizational climate, as well as having the infrastructure, equipment, policies, knowledge of the active play standards, and receiving training all supported the practice change. So this actually gives you an overview of what we found in terms of our results. Next slide. So what we did find is that the active play standards and appetite to play initiative did support changes in policy and practices over time. But one thing that I wanted to highlight is we know that certain processes need to be in place for continued use and sustaining changes over time. We did find this when we did looked at this in the context of Action School BC, that we need to ensure that we support change over time, because we do know that people will make change, but the implementation kind of fizzle over time. So we've developed the ATP program, the Active Play Program Plus, to actually support sustaining change over time. And let me talk a little bit about what is coming forward. So the ATP Plus program was designed to sustain implementation of the Active Play standard over time by providing both educator and manager with the best practices and strategy that facilitate maintaining change in practice. And it's really the over time that we're focusing on. So we want to actually support the change, but to make sure, like, how do we keep it alive, interesting, and how do we continue, to sort of innovate over time? Next slide. So the focus of ATP Plus is actually in the red box, but I'm going to keep it very simple in terms of highlighting what ATP Plus focus on. And essentially what we have for ATP is its support facility in implementing the best practices. So we're talking here about engaging both the staff and manager in assessing their practices, goal setting and monitoring, and figure out a system over time and how do you engage your facility in keeping the initiative alive. And we also continue in providing and supporting providers in implementing best practices. And we refer back a lot to the Active Play program resources, but also try to get people to sort of innovate and change. Next slide. So what the ATP Plus program aims to do is it takes it starts with an audit in making sure, and it's a simplified audit where the facility could access their current policies and practices. And this provides initial assessment and valuable input for setting goals and for planning. And once we have this information, it is both the manager and then the staff that gets through an assessment of what they are doing collectively. And then they get to meet, and we support that engagement of staff in goal setting and planning. And then this is essentially to help them set short and long-term goal to sort of institutionalize their practices and maintain change over time. We embed professional development and include internal and external support. Next slide. So just to give you a quick overview is that the ATP Plus, the Appetite to Play Plus program includes 3 e-learning modules, which is a combination of online materials plus videos. We have activities to support the learning, and then we have reflection and sharing of knowledge that occurs in that setting. And then the content is tailored both the educators and managers, and we provide online support over a year. And then we'll include expert presentation over the year, and then you'll have access to resources, but also learn how you could utilize the resources that are currently available in the Appetite to Play. We will go through our content review, which will begin in the summer of 2022. If you're interested, please contact us because we would love to hear your feedback as we continue to develop the program. And then we hope to begin in testing in the fall of 2022. Next slide. Well, as to sort of conclude my presentation, and then I'm going to open up to questions. And I don't know if we want the rest of the panel to sort of join us, because there may be questions that maybe PJ would like to answer as well, and Claire. Thank you.
Yes, thanks so much, Louise. And that's exactly what I was going to ask our audience to do is please send in your questions for any of our presenters. I do have one for you, Louise. It says, thank you for an interesting presentation. Can you describe the organizational culture that you mentioned that supports physical activity?
So when we assess organization culture, we assess whether people are supporting of, physical activity, whether they're supportive of change, and then this is kind of like the thing that, whether, they're accepting, whether they're engaging, and then rapidly engaging in change and discussions, and whether they're positive. Yeah.
Well, that makes sense.
Yeah.
I have another question here. It says, for Louise, you mentioned that mentoring was important, i.e. having someone who can teach how to do fundamental movement skills. Where might these mentors come from? Part of Appetite to Play? Question mark.
Yeah, so we heard about that mentoring or having somebody who could help from the qualitative interview. And then one of the things that is quite important is to actually identify within your facility whether you have somebody who could champion some of these things, somebody who loves physical activity or like to find new activities and could bring this forward, so that you could also engage in somebody who was actually having less facility and engaging in physical activity. And then I'm sure everybody has, somebody who is actually a bit more physical activity keen in your setting that would take on that role. And so that's one of the things that we actually, sort of encourage to identify somebody who is a champion, could come up with ideas. And even sometimes it doesn't come necessarily as, readily easy. You could actually probably try to figure out somebody who might be willing to discuss, like, how do we make it easy? How do we engage? And how we, just could even facilitate discussions. Yeah.
Yeah, and you really saw that in your slides there, where being physically active was that predictor, and that's not surprising in terms of role modeling and valuing physical activity. What we know about physical literacy, right? So I do have another question here. My child does not attend daycare. I'm wondering about activities I can do at home with my 3-year-old to begin to develop fundamental movement skills.
Oh, do you mind if I answer?
Yeah, of course, please.
I will push. There's a Appetite to Play is currently reaching out to develop interventions for family resource providers who engage with families. But the other thing is, many families are accessing the resource itself because all the ideas and activities are there and available. So lots of activities are on the site, many. And we do find that parents are, I don't know if Sana's online, but they're finding parents are reaching it and coming to find them for now. And there's other initiatives underway in British Columbia to support parents as well. They're a major target. But right now, there's a million ideas at Appetite to Play and other resources, national resources.
Yeah, I just can't speak highly enough of that, of the Appetite to Play program. We're big fans at BC Alliance for Healthy Living. Of course, we were involved with it to a small degree, but it's really nice to see this, non-biased, rigorous evaluation also demonstrates what a great initiative it is. Louise, did you want to say something?
No, I think I wanted to reiterate what PJ was saying, but it was kind of interesting because I have new parents into my team who are, just devouring the information, the Appetite to Play site, and it's like, this is useful for every parent. So
especially when you're stuck at home,
and look up, like, yeah, Claire, when you start looking at it, you found, even for yourself, you found some great idea for your child. Yeah.
Well, especially when the kids were at home and school was out during COVID, I found as a parent there was a lot of really good resources that I was able to draw on, and ended up just buying some sort of equipment that I still use for rainy days. So yeah, equally as useful for childcare workers, but also for families. Definitely a lot of easy resources.
And it's interesting, there's a lot more video content on there. So if you want to do make at home equipment, so it's not expensive, there's now some video content there where they show you how to use a pool noodle target or any of those things. So there's quite a bit that's applicable.
Oh, that's great. Well, wonderful. I think we've run out of time, but thank you all so much for the fantastic and important research that you do. It's wonderful to have researchers who are looking at practical applications to make our world healthier and our kids healthier. And so we just really appreciate the work that you do and your presentations today. Just really fascinating stuff, really important stuff. And I just want to also thank all of our audience members for showing up today and for being interested in this, and just want to wish everyone a happy, active rest of their day. Thank you.
Thank you.